If you needed surgery in the early 19th century, you didn't go to a quiet, sterile room. You went to an anatomical theater. Operations were public spectacles, performed in front of packed galleries of paying crowds who leaned over the wooden rails to watch the gore. Going under the knife was a strict last resort. Without any form of pain relief, the sheer agony of a surgical procedure triggered massive physiological shock in the patient's body. This chart shows the grim reality of the era. Out of every 100 people who risked an operation, 80% developed severe infections, and half of all patients died either on the table or shortly after. Your only real chance of surviving the ordeal was speed. You needed a surgeon who could hack through tissue and saw through bones so quickly that your nervous system didn't have time to shut down. Enter the Scottish doctor Robert Liston. He was the ultimate product of this environment, earning a reputation as the fastest knife in the West End. Liston knew exactly how to play to the crowd. He would stride into the operating room, unbutton his heavy coat, turn to the gallery of medical students, and shout, "Time me, gentlemen." In the 1840s, raw velocity was the sole metric of surgical success. Shaving seconds off an amputation was the only barrier standing between a patient and death. Performing surgery at that pace was a violent, highly physical struggle. Before a single cut was made, it took several strong assistants pinning a thrashing, screaming patient down against the wooden table. To maximize his efficiency, Liston developed a terrifying trademark technique. After slicing through the muscle, he would clamp the bloody scalpel in his teeth, freeing up both hands to grab the massive bone saw. The tools of the era matched the method. They were not built for delicate, meticulous precision. They were heavy, blunt instruments designed for brute force hacking and rapid amputation. Operating like this pushed human speed to its absolute physical limits. But moving a razor-sharp blade at a frantic velocity left a surgeon with no margin for error. That lack of a safety net resulted in a dark legend surrounding Liston's most infamous operation. He was moving so violently fast during a leg amputation that his technique collapsed into a lethal blur. In his frenzy to sever the patient's limb, Liston's flashing blade missed its mark and sliced clean through the fingers of his own surgical assistant. The chaos didn't stop at the operating table. An elderly spectator watching from the viewing gallery was so terrified by the flying blade and the sudden spray of blood that he collapsed and died of a heart attack on the spot. Over the following days, the tally climbed. The original patient and the newly fingerless assistant both contracted hospital gangrene and died, resulting in 3 separate fatalities from a single routine amputation. Liston remained the fastest knife in London, but this surgery showed that pure velocity had reached its limit. The pressure to beat the clock had turned a routine amputation into a 3-death catastrophe. By late 1846, the necessary intervention arrived. Across the Atlantic, an American dentist discovered a way to induce unconsciousness by having patients inhale a chemical gas called diethyl ether. News of this mysterious vapor spread rapidly across the ocean. By December of 1846, the knowledge reached Robert Liston's operating theater in London. When Liston prepared for his first ether operation, the packed gallery was unaware of the chemical. The crowd braced themselves for the usual gruesome spectacle of thrashing limbs and agonizing screams. Instead, the patient inhaled the gas and slipped away. Liston cut through the leg just as cleanly as always, but the patient didn't flinch. They didn't make a single sound. Looking up at the utterly silent room, a stunned Liston dropped his saw and muttered to the crowd, "This Yankee dodge beats mesmerism hollow." Liston's blistering speed was a necessary evil of the medical dark ages, but his willingness to embrace ether killed the surgical spectacle for good. Anesthesia permanently untethered doctors from the stopwatch, allowing them to finally practice the slow, meticulous, life-saving science we rely on today.